Okay, so you've recently hurt your hip, now what? Usually what happens is someone hurts their hip and then they go to their primary care doctor. The primary care doctor takes an x-ray, maybe gives them some pain medicine and says go to the specialist. But what do you actually do next? And then let's say you get into a specialist in the next 3 months and you're sitting there, well, what is actually going to happen to me? That's not your fault. No one ever explains the pain journey. You might have questions like, do I ice it? Do I heat it? Do I exercise? Do I rest? Do I go to physical therapy? Do I need surgery? Do I need injections? Do I need medicine? Can I return to the stuff that I liked doing? And you might have heard scary things, or you might have found them online, like hip impingement, hip arthritis, the shape of your hip is different. And you really are trying to figure out, well, what do I do with this information, and is this bad? In this video, I want to try to demystify all of that for you. So I'm going to give you ways to help you heal faster, I'm going to explain your hip pain, and I'm going to give you some exercises at the end to try to help with that. My name is Jansen Imut. I'm a physical therapist. I have my doctorate in physical therapy. I'm residency and fellowship trained in orthopedic and sport injury. I've been doing this for 12 years. And so if you're here, you've probably seen my YouTube shorts, and I really appreciate everyone who's supported the YouTube shorts up until this point. Today I wanted to do a long form video in regards to hip pain. So I don't think my editing is going to be that good, so if you have any ideas or tips or any constructive feedback, I'd be more than willing to hear it, but let's go ahead and jump into the hip pain video today. Also, with that being said, although the editing may not be good, I promise that the content is. So let's talk about what hip pain is. Oftentimes hip pain is not caused from one structure. So the pain might be coming from the joint or the labrum or the muscles or the nerves or maybe all of that. So with that being said, a lot of times images cannot predict a patient's symptoms. So there's a lot of patients that have no image findings on the x-ray or the MRI, and they have significant pain. And then there's people on the other end of the spectrum with significant findings on the x-ray and no pain. So we always say, how do you explain that? And what I mean by that is you can't take an x-ray or an MRI of a patient and predict if they're having pain. So to extrapolate on that, just because you have a scary image does not predict that you're going to do poorly in physical therapy, or that you're not going to recover, or that you're going to have pain forever. You can have tears or breaks or chips and still do perfectly fine once everything heals up and you get rehab. So it's very important to remember that structural findings on an image are not the same as a patient's symptoms. Hip pain often shows up first with walking. And the reason for that is because walking is essentially a repeated single leg task over and over and over again. So that is usually where pain shows up, because this is actually pretty challenging for the hip. And so if the hip is not strong enough or ready for that load, it can be painful. That's why things like sitting, stretching, and sleeping typically don't cause hip pain, but then walking does. So that should start cueing you in that if you're having pain in your hip with walking, there's something going on with a load tolerance mismatch. And what I mean by load tolerance mismatch is that hip is not ready to accept your body weight, and we need to get it stronger and ready for that task. So another misconception that we see commonly in the clinic from our patients is you have to wait for your hip to fully heal before you can start moving or exercising again, and that's just not true. Having a painful hip does not mean the damage is worsening, and also avoiding movement altogether is not making the hip more safe. There's large studies that show that you do not have to wait for your hip to fully heal before you can rehab it successfully and decrease your pain. If you wait for the hip to feel perfect and the tissue to fully heal, the hip is going to stay sensitive, and that's not what we want. You need to start moving. Another common misconception that we see is that rest is good. And while that might be true in the short term, it actually backfires in the long term. So when you rest excessively, your muscles become weak, your coordination drops, your tolerance drops, and your nervous system becomes more protective, ultimately meaning that your hip is going to be more painful. So with rest, instead of your hip feeling safer, it's actually becoming more painful with daily activities like walking, standing, and sitting. So this is when people really start to worry, is when they get their image results. And I want to be very clear, I'm not anti-imaging, but going back to what I said previously, you can't predict a patient's pain with just their image alone. Our best hip pain data shows that we can't rely just solely on the image. We have to see how the patient moves, how they tolerate load, what their pain level is, and also what their function level is. So we can't say, okay, this image does not look good, therefore the patient is not going to do well. That's just not true. So if you're thinking, well, what the hell actually works? We're going to get there. So we want to keep several core values in place here. A little bit of rest is okay in the beginning, but not long term. That's not going to solve the pain. We want to progressively load you. So we start with very gentle exercise, and then we slowly make it more difficult as time goes on. And then if you have a flare-up, that's okay. Then we get back on the horse and we keep going forward even more. And as a side note, flare-ups are common, they happen. If you take a little step backwards, that's okay as long as we keep moving forwards. If everyone just kept getting better and better and better with no hiccups or no setbacks, that's not real life, that's not how it happens. And lastly, we want to build confidence in your movement. So whatever the tasks that you need to do in your daily activity, whether it's working, sitting, sleeping, working out, running, we need to slowly build your brain's confidence in that movement. So before we get into exercise, I wanted to give a medical disclaimer. I am in no way treating or diagnosing anyone's pain. This is purely for educational purposes. If you're having pain, you need to go see your doctor immediately. An exercise that I love starting with to build hip tolerance is a simple bridge. So what I like to do is I have the patient suck their belly button in towards their spine. They squeeze their butt cheeks together like they're pinching a dollar bill, and then they're going to lift up a little bit. And they're going to hold for 5, 4, 3, 2, 1. And I typically like having the patient do this for about 3 minutes. Another exercise that I like having the patient do is go on their hands and knees. This is more for range of motion. Hands under the shoulders, knees under the hips. And you have the patient slowly rock back to where they're comfortable and then come back up. And then again, I'm going to have the patient do about 30 of these as long as they don't have any shoulder, hip, or knee issues. Another exercise that I love having people do for hip pain is they're going to take a step forward, shift all their weight on their right hip. They're going to do a little squat, keeping their kneecap in line with their second and third toe. And you're going to do 10 and you'll do 3 sets. And lastly, this is to build hamstring strength and low back strength. You're going to bend the knees slightly. You're going to keep your head and your chest up. You're going to come down and touch the floor, and then you're going to come back up.